Which of the following is a barrier to care for some patients? So keep in mind what a barrier is. So if you think of like a barrier, it's kind of like a blockade, so it prevents something from happening. So we're looking for something that makes it more difficult for a patient to achieve health care, because we're discussing patients and we're discussing healthcare, so we're looking for a difficulty involved here. Option A says having a primary care physician. And no, because if you have a primary care physician, that's something that would make it easier to access healthcare, because you have a provider you could go to anytime you're sick and you need to go be seen. If you don't have one, then that would be a barrier, because you might not know where to start or who to go to. So we can eliminate option A. Option B is socioeconomic status. And depending on what that status is, it could be a barrier. If someone's a low socioeconomic status, they don't have a lot of income, maybe they don't have health insurance, they might not know where to go, that could be a barrier, because then they might feel, oh, if I go to see my provider, I'm going to get a bill, I might not be able to afford it, maybe I'm having trouble finding a provider that could take the kind of insurance that I have. That could definitely make things more difficult and hence become a barrier. So we could go with option D. But let's take a look at the other choices. Option C says being knowledgeable about health. And if you're knowledgeable about your health, then that typically helps you in the healthcare field as a patient, because you might have an understanding of what seems serious to you, when you want to go be seen by your provider. So that would be something that would help you and not be a barrier. So let's eliminate option C. And then option D says having health insurance. That definitely is something that helps to see a provider or see a healthcare setting, and it's not considered a barrier, because if you have your insurance and you know you have coverage and it won't be so expensive, that will encourage you to go when you need to be seen. So we can eliminate that. And then that leaves us with option B, socioeconomic status, as being a barrier for some patients.